18 more people succumbed to the virus over the last 24 hours. This as health facilities continue to be overwhelmed, with 6 more patients being admitted to intensive care units. ICU beds in Nairobi and neighboring Machakos are already full, with patients on waiting lists. It is also a day the journalism fraternity is mourning. Reuben Githinji, a star newspaper correspondent based in Embu, succumbed to COVID-19 at the Murang'a Level 5 Hospital. Let's begin our broadcast with our very own Dorcas Wangira.
Reuben Githinji, a 52-year-old newspaper correspondent working for the Star based in Embu, died due to COVID-19 related complications while receiving treatment at the Murang'a Level 5 Hospital. 18 deaths have been recorded in the last 24 hours, 1 having occurred in the last 24 hours and 17 being late deaths. 1,540 more people have tested positive, bringing Kenya's caseload to 124,707. From 9,348 samples, the test positivity rate is 16.5%. 1,073 patients are admitted in various hospitals and 3,315 are in home-based care. 141 patients are admitted in ICU, an increase from 135 Tuesday.
Of which 34 of them are on ventilatory support, 99 are on supplemental oxygen, 8 are on observation. And unless this trend is arrested, we may have no alternative but to take more stringent measures as necessary to protect the lives of our people.
COVID-19 has tried and tested Kenya's health system, and particularly the country's and individual counties' capacities, as is Nairobi's public hospitals and several private hospitals are overwhelmed with no more ICU beds available. According to data from the Ministry of Health Tuesday, the Kenyatta National Hospital's 86 ICU beds are full to capacity. Nairobi Hospital's 36 ICU beds are also full. The Kenyatta University Teaching and Referral Hospital's 32 beds are also full. The Nairobi West Hospital's 46 beds are half full, and the MP Shah's Hospital's 6 ICU beds are also full. Likewise, all the Machakos Level 5 Hospital's ICU beds are also full. Though not all beds have COVID-19 patients, the high rates of infection and severe disease requiring intensive care is a great contributor to the ICU burden.
The shortages in the country and in the counties are real. Do not take lightly the fact that there is no ICU space, the fact that isolation wards are getting full in record days. That would mean that most will lack access to healthcare.
Nandi County has 15 ICU fully equipped and operational beds stationed at Kapsabet County Referral Hospital. However, the challenge is personnel working at the ICU. For the unit to run efficiently, a whole team comprising nurses, clinical care physicians, physiologists, paramedical engineers, as well as nutritionists is needed, and Nandi has to partner with the Moi Teaching and Referral Hospital to train more nurses working in the critical care unit so as to supplement the shortage of personnel. West Pokot has 6 ICU beds, but will only be fully functional when trained personnel are availed. Uasin Gishu has a 20-bed ICU capacity, Meru 4 ICU beds, Kisii 15, Vihiga 5, though not fully functional, and Kakamega has an ICU capacity of 16, but not all are functional, with some requiring electrical and mechanical works to operate. In the last 9 days, Nairobi and its neighboring counties have recorded the highest number of cases. Nairobi has recorded 5,718 COVID-19 cases, Kiambu 888, Nakuru 626 and Machakos 414. The pattern is that the virus's epicenter remains Nairobi and it is spreading to its neighbors. And if one county lacks ICU care, the burden shifts to the next county as Kenya continues to grapple with a vicious third wave of COVID-19. Dorcas Wangira, Citizen TV, Nairobi.